ബ്ലഡ് കൊടുക്കണമെങ്കിൽ അത് ലാബിൽ ടെസ്റ്റ് ചെയ്യണം. അവിടെ ടെസ്റ്റ് ചെയ്തിട്ടാണ് LFCN ടെസ്റ്റ്. അത് ബ്ലഡ് കൊടുക്കാറുള്ള ഞങ്ങളായിരുന്നു ഡോക്ടർ വിളിച്ചു.
ഡോക്ടർ ഡോക്ടർ അനുവിനിപ്പോ എങ്ങനെയുണ്ട്?
അനുവിനിപ്പോ പ്രശ്നമൊന്നുമില്ല. ബ്ലഡൊക്കെ അറേഞ്ച് ചെയ്ത് കൊടുത്തിട്ടുണ്ട്. ഇതിലാരാ അനുവിന് ബ്ലഡ് കൊടുത്തേ?
ഞാനാ ഡോക്ടർ.
കുട്ടീൻ്റെ അടുത്ത് ഒരു കാര്യം പറയാനാ വിളിപ്പിച്ച്. കുട്ടിയുടെ ബ്ലഡ് ടെസ്റ്റ് ചെയ്തപ്പോൾ അതിനകത്ത് HIV പോസിറ്റീവ് എന്നാ കാണിച്ചേ.
HIV പോസിറ്റീവോ?
അതെ. വിഷമിക്കാനൊന്നുമില്ല. എന്ത് ചെയ്യുക കുട്ടി?
ഞാൻ നഴ്സിംഗ് സ്റ്റുഡൻ്റ് ആണ് ഡോക്ടർ.
അപ്പോൾ പിന്നെ ഇതിനെപ്പറ്റി പ്രത്യേകിച്ച് പറഞ്ഞു തരേണ്ട ആവശ്യമൊന്നുമില്ലല്ലോ. നമുക്ക് മനസ്സിലാക്കാമെന്നല്ലേ ഉള്ളൂ. ഇത് രോഗപ്രതിരോധ ശക്തിയിൽ ബാധിക്കുന്ന ഒരു അസുഖമാണ്. ഇതിന് പ്രത്യേകിച്ച് ട്രീറ്റ്മെൻറ്റ് ഇല്ലെങ്കിലും നമുക്ക് രോഗപ്രതിരോധ ശക്തിയെ കൂട്ടാൻ വേണ്ടിയുള്ള ട്രീറ്റ്മെൻറ്റൊക്കെ എടുക്കാം. നമുക്കിതിന് അതിജീവിച്ച് പോവാം. ഇതിന് വിഷമിക്കേണ്ടതെന്ന് ആവശ്യമില്ല. കുട്ടി മെഡിക്കൽ സ്റ്റുഡൻ്റ് ആയതുകൊണ്ടായിരിക്കാം ഇതൊരു പക്ഷേ വന്നത്.
ശരി ഡോക്ടർ.
ഗുഡ് മോർണിംഗ് സ്റ്റുഡൻസ്. നമുക്ക് പുതിയൊരു ടോപ്പിക് എടുക്കാം.
എക്സ്ക്യൂസ് മീ മാം.
യെസ്.
മേ കം ഇൻ?
യെസ്. എന്താ ലേറ്റ് ആയത്?
ഹോസ്പിറ്റലിൽ പോയിരുന്നു മാം.
ഓക്കെ, ഗെറ്റ് ഇൻ. എന്ത് പറ്റി രീഷ്മ? മാം, നമുക്ക് ഇവിടെ ഇരിക്കാൻ പറ്റത്തില്ല. അതെന്ത്? ഇവർക്ക് AIDS ആണ്.
Every year on 1st December, the world commemorates World AIDS Day. People around the world unite to show support for people living with and affected by AIDS and to remember those who lost their lives to AIDS. No one is safe unless we all are safe. The HIV response has much to teach the fight against COVID-19. We know that to end AIDS and defeat COVID-19, we must eliminate stigma and discrimination, put people at the center and ground our responses in human rights and gender-responsive approaches. What is AIDS? Acquired immunodeficiency syndrome is a chronic, potentially life-threatening condition caused by the HIV virus. By damaging the immune system, HIV interferes with the body's ability to fight infection and diseases. The incidence: 37.7 million people globally were living with HIV in 2020. 1.5 million people became nearly affected with HIV in 2020. 680,000 people died from AIDS-related illness in 2020. 27.5 million people were accessing antiretroviral therapy in 2020. 79.3 million people have become infected with HIV since the start of the epidemic. 36.3 million people have died from AIDS-related illnesses since the start of the epidemic. How the AIDS is transmitted? HIV is transmitted when the virus enters the body, usually by injecting cells or semen. There are several possible ways in which virus can enter. First, the sexual contact. In 75% cases, transmission is by sexual contact. Most commonly, HIV infection is spread by having sex with an infected partner. The virus can enter the body through the lining of the vagina, vulva, penis, rectus or mouth during sex. People who already have an STD such as syphilis, genital herpes, chlamydial infection, gonorrhea or bacterial vaginitis are more likely to acquire HIV infection during sex with an infected partner. The second cause is the parenteral. In 15% of cases, it is by blood transfusion or blood product transfusion. Sharing of utensils, needles, syringes in drug addicts contaminated with blood from an infected person can spread virus. HIV can be spread in health care settings through accidental needle prick injuries or with contaminated fluids. HIV can also spread through organ transplantation. Donors are now tested for HIV to minimize this risk. The third one is the transmission from mother to child. Women can transmit HIV to their babies during pregnancy or birth. When infected mother cells enter the baby's circulation, 30% of children born to infected mother have the acquired infection unless virus is treated by antiviral drugs. In nursing mothers, transmission can occur through breast milk. How can we diagnose HIV? HIV or AIDS is diagnosed via laboratory testing and then staged based on the presence of certain signs or symptoms. Blood test. The antibody test. Rapid test ELISA third generation within 23 to 90 days. Antibody and P24 antigen test ELISA fourth generation within 18 to 45 days. PCR test within 10 to 33 days.
Prevention of HIV. Consistent condom use reduces the risk of transmission by approximately 80%. There is some evidence suggests that female condoms may provide an equivalent level of protection. Application of a vaginal gel containing tenofovir immediately before sex seems to reduce infection. Comprehensive sexual education provided at school may decrease high-risk behavior. Pre-exposure. Antiretroviral treatment among people with HIV whose CD4 count less than or equal to 550 cells is very effective way to prevent HIV infection of their partner. Pre-exposure prophylaxis with a daily dose of the medication tenofovir. Universal precautions within the healthcare environment are believed to be effective in decreasing the risk of HIV. Intravenous drug use is an important risk factor and harm reduction strategies such as needle exchange program and opioid substitution therapy appear effective in decreasing this risk. Post-exposure. A course of antiretrovirals administered within 48 to 72 hours after exposure to HIV-positive blood or genital secretion is referred to as post-exposure prophylaxis. The use of single-agent pseudovirus reduces the risk of a HIV-infected five-fold following a needle stick injury. Mother to child. Programs to prevent vertical transmission of HIV from mother to children can reduce risk of transmission. This primarily involves the use of combination of antiviral medications during pregnancy and after birth in the infant and potentially includes bottle feeding rather than breastfeeding. If replacement feeding is acceptable, feasible, affordable, sustainable, and safe, mothers should avoid breastfeeding their infants. However, exclusive breastfeeding is recommended during the first month of life. If exclusive breastfeeding is carried out, the provision of extended antiretroviral prophylaxis to the infant decreases the risk of transmission. Vaccination. Currently, there is no licensed vaccine for HIV or AIDS. The most effective vaccine trial to date, Retroviral 144, was published in 2009.
Can I get it by touching someone? Can I get it by kissing someone? Can I get it by a mosquito bite? Can I get it from swimming pools? Are you confused? Don't be. HIV isn't that easy to be contracted. The 5 main ways it can spread are unprotected sex, from mother to child during pregnancy, childbirth or breastfeeding, injecting drugs with a needle exposed by the infected blood, infected blood donations or organ transplants, a healthcare worker who takes the blood samples of the infected patients. 36 million people in the world live with HIV. It spreads like a virus from one person to another. It can cross the boundaries, cities, states, and even countries. And it even can reach you anytime. The effects of HIV in the body. Once the HIV enters your body, it launches a direct attack on your immune system. It gradually weakens your natural defenses against disease and infections and can affect every part of your body. Find out how. Fever, cough, rash, a strain on the heart, night sweats, muscle aches.
As the World AIDS Day theme reminds us to end HIV domestically and globally, the US government cannot act alone. We will continue to strengthen our relationship with community-based organizations, network of people with HIV, clinicians and researchers and state, local and foreign governments, and support innovations that address individual, community and structural factors and inequalities that drive the HIV epidemic. Critically, we will ensure that people with lived experiences are valued and at the center of the planning, development and implementation of our efforts. Thank you.